Hey, welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, August 30th, 2023. First item on the agenda is Pledge of Allegiance. Please join me.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Next is citizen input for items not on the agenda as a public hearing. So Carl Shoemaker, thank you for joining us.
Thank you. I'm Carl Shoemaker. I live in Bend. A Children's Fairy Tale by Kurt Vonnegut Jr. You meet saints everywhere. They can be found anywhere. They are behaving decently in an indecent society. And this is frequently an indecent society. Christian nation indeed. Thank you.
Thank you very much. Is there anybody else for citizen input? Or is there anyone online with a raised hand feature? Okay, seeing none, I will move to the consent agenda. Couple of financial items.
So move.
Second.
Any other discussion? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes.
I would like to acknowledge that the hospital, Deschutes County Hospital Authority Board have been reappointed, and I want to thank them. We're actually doing this on a timely basis. Their terms had ended tomorrow. So it's nice to see that on our agenda today.
Great, thank you.
Can you remind us what the scope of the Hospital Facility Authority Board's charge is?
It was set up decades ago, I believe, for financing purposes that the county is incorporated in when they do bonding. Last year's meeting was incredibly important because the hospital had done some refinancing, and we are the people that have to sign off on it. So that's why it comes through the county. But I do have an update over Medicare Advantage. I did have an email conversation with Matt Swafford, and negotiations are happening. And I also had a conversation yesterday with Humana, and they are part of the negotiation. Pacific Source, Humana, and there are some other insurance carriers in there, but they are negotiating. So I know that a lot of our community is incredibly concerned about it. It looks like the right things are being done.
Yeah, I think it's all about just tax exempt finance bonding, that they need to have this structure set up so they can bond for tax exempt.
About what I remembered, but I was just curious whether there was any really relevant things happening. It's good to know about that last round of refinancing.
Yes, that was actually a year ago.
Okay, at this time, item number 5, public hearing to consider proposed amendments to the Deschutes County Code relative to signs placed within county road right of way. This will be a public hearing on the matter also.
Good morning, board. For the record, Cody Smith, County Engineer and Assistant Director, Deschutes County Road Department. The road department has proposed text amendments to Deschutes County Code 10.05. 10.05 pertains to right-of-way signs placed within a public rights of way under Deschutes County jurisdiction, other than traffic control devices that are placed by the road department. In general, these include temporary signs that are placed under by permit, as well as tourist-oriented directional or motorist-oriented directional signs that are placed within our right-of-way. By and large, most of our current code was drafted and adopted back in 1991. When that code was written, there was under the provisions regarding temporary signs, there was a provision that also allowed for political signs to be placed within the public right-of-way by permit. Not really sure why this was included in there. Reviewing the minutes from the proceedings for when that code was adopted, there was no, it doesn't appear there was any discussion about the matter of political signs, but nonetheless, that's what's been in our code. And as such, the road department has administered a program for permitting temporary signs, including political signs, for the last 30 years or so. In recent years, the permitting and administering permits for political signs within the public road right-of-way has become extremely challenging for the road department for a number of reasons. Number one, just the number of signs, both number of permits and number of signs permit under each individual permit has significantly increased in the last 5 years or so. The size of the signs that are being proposed or placed to be put out in a right of way have significantly increased. A lot of times now what we're dealing with is full plywood sheets that permittees want to place out in the right of way. And all of this is adding additional clutter to our right of way, causing sight distance issues, causing distractions for drivers that and as such, we road department more and more is receiving complaints from property owners and the traveling public regarding these signs. The program itself also causes some confusion for the permittees themselves and the campaigns that are applying for these permits, just not understanding, this is our program is not consistent with what other road agencies in the county and even in the state are doing. It appears that no other road agency in the county authorizes these types of signs in their right of way. So as we're the only county who's actually administering a program to allow for this, there's just confusion from the political campaigns who are applying for these permits. There's also often complaints from permittees in regards to other signs that have been placed out by other campaigns. So with all these issues and the burden this has caused on the road department, it's compelled the road department to evaluate this matter a little more here in recent years. And what road department staff has determined is that in addition to the challenges just in administering this program, there's some other fairly serious problems with the permitting of political signs within public road rights of way. One of those is just a lack of statutory authority under ORS 368, the county road statutes. The posting of any type of signs or bills or anything within public rights of way is forbidden except for in certain cases, and the statute doesn't make it clear that political signs is one of those cases. Also, just in regard to the nature of public road rights of way that are under our jurisdiction, that are effectively easements that are there to provide for public ingress and egress, public transportation, as well as utilities for the transmission of utilities. There's nothing really built into that provides for allowing the placement of political signs. There's also the issue of adjacent property owners and their residual property rights that generally extend to the center line of our roadway, and challenges with us permitting things that are not road related to occur in that easement across their property. And lastly, and similar to what I already mentioned, the inconsistency with other public road agencies, both locally and statewide. Oftentimes election season, ODOT, cities of Bend, cities of Redmond are pretty actively putting out media releases and messaging, encouraging people not to put their political signs in the right of way, that they will be removed. Meanwhile, we, the county road department, are administering a permit program to allow the thing that everyone else is actively prohibiting. So for these reasons, the most significant change in this proposed text amendment is the removal of the permissibility of political signs or the permitting of political signs within the public road right of way. In addition to that, there's some other text amendments in here that just to better organize the code as in particular as it relates to the administration of permitting for tourist or motorist oriented directional signs, as well as the administering of other temporary activity signs for special events and other things that are permissible under statute. I want to emphasize that this has no bearing on signs that are placed on private property. Signs placed on private property are regulated under Deschutes County Code 15.08. That's not administered by the road department. It's not administered under under Title 10 in our county code. So with that, I'm happy to answer any questions that the board has, but otherwise, I guess I'd turn it over to the board and or legal counsel for more of the procedural matters here.
Okay, thank you very much. So at this time, this is a public hearing on the matter, and we'll open the public hearing. And is there anybody here to testify in this matter? Is there anyone online? So nobody's used the raise hand feature. We have received a few emails referring to First Amendment rights and kind of digesting what has maybe happened across the country and federal rulings. But this is truly the right of way, just kind of that soft shoulder at the edge of the road between that and the front yard of somebody's house. So just put it in perspective.
Yeah, I think the most important thing to make clear to the community is that this does not affect an individual landowner's opportunity to put a sign on their property just outside the right of way.
That's correct.
Okay, so this has been a public hearing on the matter. At this time, we'll close the public hearing. And as I say, we have had a few emails on the matter. At this time, is there any discussion? Are we ready to proceed? This is kind of a quiet item today, but yeah, it was noticed in the media from our previous work sessions. I think it was, wasn't it? Somebody in the media picked it up. So at least some people have heard about it if they're not following our agenda specifically.
I do have a question, Cody. So I have a neighbor who allowed me to put my sign, and it's like right at the corner. It's on their property, but it is at the corner of the intersection. So would that be considered inappropriate if it's on their fence, but it's at the corner of the right of way?
Again, this particular chapter in our code is not pertaining to private property. So their fence, I'm going to assume is
On private property.
on their property. That's their private property. So that this proposed amendment would have no implications to that situation.
Okay.
Could you just, just for public awareness, could you give us a sense of for different classes of roads, how wide the right of way is?
Well, it varies. In general, most of the majority of the right of ways that are under our jurisdiction are 60 feet wide. Generally, the road center line should be centered within that right of way. That's not always generally the case, but that's more or less the rule of thumb. So yeah, 60 feet in general. There are variable width right of ways around the county. We have in some case under county code. We require 80-foot right of ways for our arterial roads. We don't always have those necessarily. Some places we've got less than 60 feet of right of way, but it can vary. But generally, the best rule of thumb is 60 feet. So 30 feet either side of center line.
I mean, after you take out the pavement width, but how much is left of that 30?
I mean, pavement widths can be variable too, but I mean, in general, if we have a 22-foot wide pavement width, half that's 11 feet. So we have another 19 feet outside of the paved roadway width. But again, that can be real variable. I mean, when we're talking about, the situation that Commissioner Adair just raised with putting it on a fence, generally, we're gonna consider, okay, that's probably the property line there. It doesn't necessarily mean it is if we actually had a surveyor out there surveying the right of way, surveying boundaries, but in most cases, we're not going to go to that effort unless we have some type of egregious safety hazard or obstruction that we need to deal with. So,
Thank you.
Okay, good discussion. Is there support for a first reading or other deliberations?
I'll move first reading by title only of ordinance number 2023-020.
Seconded.
Okay, it's been motioned and seconded for a first reading by title only. Any other discussion? Seeing none. Commissioner Chang,
Yes.
Commissioner Dare,
Yes.
and Chair votes yes. So this is an ordinance number 2023-020, an ordinance amending title 10.05 right-of-way signs of the Deschutes County Code. Second reading in 2 weeks.
thank you.
Thank you. Item number 6, use of opioid settlement funds. Janice, thanks for coming to join us here, and looks like there's a presentation. I know we've kind of digested this topic, and it has come before us in the past, and we'll see where we get today. Well, 5 minutes from I guess 40 minutes, 25 minutes. Well, so I was expecting somebody to come in and talk about a sign right away.
There'll be a lot of confusion and commotion come election season.
Okay, sorry for the delay. Good morning, commissioners. My name is Janice Garceau. I'm Director of Health Services, and I am here today with
Phoebe Holcomb, Director of Community Justice.
also joining us is Cheryl Smallman, our Chief Financial Officer for Health Services. She'll be here in case there are any technical questions about budget items. And I believe Jessica Jacks, I saw her coming into the building, so
Yep.
she will be here any moment. We do have a PowerPoint presentation, so I'm going to ask to have that pulled up on the display. And just to sort of set the table, we are here to present information about proposed strategies for the use of opioid settlement dollars and request approval from the board to move forward with those strategies. So you can go to the next slide. I just included here, because this is always an issue, a little acronym and abbreviation list, so that if we use some terms of art or acronyms, which we try not to do, you at least have a shorthand reference there for your assistance. Next slide. To provide some, am I able to operate from here? Okay, thank you. I'll take it from here. Sorry, I didn't know I had the power of the cursor. So as you all know, the nation has experienced a crisis in opioid addiction and overdose for really over 2 decades. Welcome. This is Jessica Jacks.
We're a little bit ahead of schedule, so
You're not late. They are way ahead of the game.
Back 40.
Do you want to introduce yourself really quick?
Hi,
for the
I'm
record?
Jessica Jacks, Prevention and Health Promotion Program Manager. Thank you.
So how we got to this moment, the opioid crisis resulted in the death of over 500,000 U.S. citizens. In fact, we're probably closer to 600,000 as of this year. Deaths were highest for young adults ages 24 to 35, and those statistics incidentally have remained fairly true in our community as well. The crisis of overdose deaths was so significant that it's believed that it resulted in the decline of U.S. life expectancy. So it was really a profound phenomenon. and resulted in other losses, obviously, because any family impacted by addiction experiences lost wages, the loss of loved ones, and other kinds of impacts. States and counties brought litigation, claiming that part of the initial cause of the opioid crisis was the underestimation of the risk of addiction for the opioids that were being distributed, and irresponsible prescribing practices on the part of prescribers, and irresponsible prescription filling practices on the part of pharmaceutical or pharmacies. The overall settlement was $26 billion. It was awarded in, I think, 2017, actually, or maybe 2018. And the result for Deschutes County is an award of $7.1 million to be awarded over a 17-year period of time. So I'm going to talk a little bit about what the picture looks like in our community. I know that you're familiar with some of this data. I tried to include some additional or more updated data. But between, oh, sorry.
Next slide, please.
Next slide. I'm going to give you control, DV. I'm not very good at talking and thinking simultaneously, but we're good.
A couple of months ago, we were talking about 6.7 million. And now you've got 7.1 million. Is it so?
The funds are constantly updating as settlement amounts come into counties. And also this may have been adjusted because of some unspent amount. No, so it was just additional dollars coming in. Okay. In our community between 2018 and 2021, the rate of overdose deaths in Central Oregon increased by 85%. And our preliminary data for last year indicates that the increase will be more like 100%. This is, thank you, DV, very much in relationship to the influx of fentanyl into the market. And we'll talk a little bit about that in a moment. But there were, we used data from our Central Oregon Cooper, Jessica, Central Oregon
Overdose Prevention and Response
Coalition. And that coalition has a data platform that collects real-time data on overdose and ED visits and deaths. So 2022 data indicated there were 273 ED visits for opioid overdose, 161 ED visits for overdose just from January to June of 2023. 185 were Deschutes County residents. And of those in 2022, 44 involved fentanyl. We believe that number is likely higher this year. 36, for example, 36 fentanyl ED visits occurred in the first 6 months of 2023. And statewide, 64% of overdose-related deaths involved fentanyl. Fentanyl is particularly a concern in our community, not just because of its low cost and its pervasiveness, but also because naloxone recovery for fentanyl requires significantly more doses than for other opioids. So an average of 3.2 doses to recover from a fentanyl overdose versus 1.7 historically has been the average.
Can we talk about, I mean, what is fentanyl, just real quick, high level? So, I mean, it is an opioid. My understanding, it was a slow release patch that was, kind of the next generation. And now it's kind of been weaponized in its powder form and now pill form. Any words along those lines?
Yeah, well, fentanyl is a synthetic opioid. You're right, it comes in many forms. When it manifested early on in the fentanyl-related crisis, it was often used in powder form and mixed with heroin. One of the phenomenon, as I understand it, is that as COVID impacted supply chains across the world, that included some of the supply chains for illegal substances as well. So heroin became less available and fentanyl in its pill form then proliferated. And so to some degree, the crisis and uptick in fentanyl use, in particular in its pill form, is very much associated with some of the sequelae of going through a global pandemic. So yet another unfortunate downstream impact of COVID. Jessica, do you have more to say about fentanyl? No? Okay. Next slide. Just some conclusions. Early identification of a drug overdose mortality spike is critical to timely prevention outreach and reducing death risk. Several communities in Oregon have seen a drug overdose mortality spike in recent years. Fentanyl overdose deaths are increasing substantially every year in Oregon since 2019. Central Oregon drug overdose deaths are also increasing along with fentanyl. And timely access to drug overdose death data and timely prevention outreach, and I would add harm reduction, are needed to respond to a spike. So one of the things that's been a phenomenon historically in Oregon is that real-time data was hard to come by. So the data dashboards that the OHA puts together, which are excellent, are often 2, sometimes even 2.5 years behind current data. And it makes it very difficult to target efforts regionally to address risk on the ground where it matters in real time.
The question, no, item number 4, there's Central Oregon drug overdose deaths are also increasing. Is that opioid related primarily, other forms of opioids?
Increasingly, the phenomenon, yes, there are opioid overdose deaths increasing. Often what we're finding is that overdose deaths and overdose ED visits involve more than one substance type. So people may have an opioid and an amphetamine on board. So it can be difficult sometimes to say exactly what's occurring. Now, the OHA dashboard will break down overdose deaths and ED visits by substance type, including polysubstance. But again, that data is 2 years old. Yeah.
And I can just add, prior to Matthew Christensen, our epidemiologist, he's on vacation, so otherwise he'd be here this week, but he shared with me that it's roughly about 2/3 of the drug overdose deaths are opioid related, and the remaining stimulants, meth and so forth, as a rough breakdown.
Great.
Yeah.
That's good.
And that is definitely a change. I would say 2 or 3 years ago, it was probably 50-50. Fentanyl, or not fentanyl, but opioid overdoses and methamphetamine overdoses. So there's definitely been a shift in the direction of opioid related deaths.
Well,
Next, yes.
explain it simply, according to Rick Chalefin from Best Care, this year, 2023, they lost 7 patients that they had been caring for. And he said, fentanyl is now, you can purchase it for $5 to $10. The cost it's peanuts.
Yeah.
Whereas people used to, how many people wanted to steal for the price of cocaine, decades ago. So it's incredibly, incredibly cheap. And normally their Best Care help for our community usually lost 1 person a year. So the fact that they lost 7 in 3 months shows you what's really happening. And then I said to Rick, well, are we going to see those numbers in the count? And then that brings up the fact that the state is so far behind on the toxicology reports. When you have a death, it's suspected of an overdose death, but the state is taking like a year. So he goes, I don't know when those numbers will hit, but that was his comments with me a couple of months ago.
Well, yes, absolutely. And if you look at slide 5, that is much more real-time data. So we have 2022 and 2023 data because of Cooper. And that was a specifically grant-funded project that is regional, that our Crook County partner got the grant, and we partner with them. And part of our proposal is expanding on that partnership to target efforts around that real-time data. So the good news is we have real-time data. The bad news is it tells us exactly what Rick is telling you, which is that deaths and overdoses have increased in the last year as a result of fentanyl.
But the really sad thing is that these were people that were actually being helped, and they still couldn't overcome, the addiction.
Yeah.
And yeah.
Yeah, I mean, one of the phenomenon of addiction, and Rick will talk about this frequently, is that relapse is a really common phenomenon. So when people are in recovery, they recover, they stay clean for a while, and they sometimes relapse. And that can happen 3 or 4 or 5 times before someone has real longevity in their sobriety. The unfortunate thing about a drug like fentanyl is if you relapse and you use a drug like fentanyl, your risk of overdose death really skyrockets because you have lowered your tolerance and you are encountering a much more lethal form of an opioid. So it's really a tragedy for people that were trying to be well and had a slip, as people can, and lost their life as a result of that. I do have some good news, though. So that was the bad news. There is a little bit of good news. So partly in response to the opioid prescribing crisis that was occurring and really drove a lot of the early stages of the opioid crisis, Oregon and many other states initiated pain standards and prescribing practices and training and guidance to physicians and to pharmacies. And the results of that effort since 2013 is a 41% reduction in problematic prescribing in Oregon, which is incredibly good news and really evidence of an effective prevention strategy. In our community, and I would call your attention to the graph on the right, what you'll see is a graphic representation of, in blue, the doses of naloxone, so the recovery agent distributed in the community. In orange, the number of doses used to reverse overdose by report of people being served. And in gray is ED visits for overdose. And one of the phenomenon that we're looking at this year is we have nearly doubled, and we're on track to continue that trend. This is only 6-month data in the 2023 section. Doubled the distribution of naloxone and the education and targeted intervention around naloxone. And what we're seeing is that the trend in ED visits for overdose is beginning to go down. That's good news for 2 reasons. One is it may be an indicator that the amount of recovery drugs out there in the community are actually helping to prevent people from landing in the ED or in the morgue as a result of overdose. The other good news is that as you read about the trend of fentanyl moving into communities, we do see that there is an initial surge in loss of life and overdose. And then as the community becomes aware, becomes educated, as people who are friends and family members of those who are using become more aware, the loss of life begins to decline. So there is a kind of surge and leveling off and hopefully decline in the phenomenon of fentanyl entering a community in our eastern states where it was initially a huge problem. So we hope we are beginning to see at least a leveling off, if not a trend downward.
Can I ask about this doses distributed and doses used? So
Yeah.
I know that there are a lot of first responders now carrying these reversal drugs.
Yeah.
Who else? I mean, are there kind of everyday people who have access to these reversal drugs and are carrying them around? Or
many of our staff carry naloxone. Bus drivers often carry naloxone. Librarians carry naloxone. Often grocery store staff will have naloxone because often places that folks who are using show up are public spaces like that. So naloxone is pretty widely distributed right now to family members and friends, and members of our homeless community carry naloxone and use it to help their neighbors who are experiencing an overdose. So it's pretty broadly out there at this point.
So are they carrying 3 doses then? Because you're saying that they've now needed 3.2 doses.
We're getting as much naloxone out as we can. There may be people carrying more than 1 dose. Yeah. And sometimes, often what will happen, and this is anecdotal, so this is not science. I'm diverging from science now. Anecdotally, what we hear is that people in the community may use a dose. Let's say they have a dose. They'll use a dose. They'll call 911. They'll perform CPR often. And in that intersection between when 911 and EMS might arrive, that dose of naloxone and those life-saving efforts might have sustained someone long enough to get another couple of doses on board when emergency responders arrive. So it's a complicated phenomenon, and it can play out in lots of interesting ways on the ground. But we're seeing some indicators that we may be having fewer emergencies related to overdose because maybe as a result of naloxone being in the community fairly broadly and people understanding how to use it and that it does work. So
and then, so you you just kind of described who might have naloxone to administer, and then the doses used. I mean, is that basically just recording? So you know who has, you track who has naloxone out there, and then those people report back.
So-
Even if it's a grocery store manager or a library, and they're reporting back, and that's what this orange column is, or
Maybe. So this orange column would be the people who officially must report back. So anyone like us or EMS or law enforcement or hospital staff, ED staff, they would be reporting the number of doses they're using. Anecdotally, when we conduct harm reduction efforts, we ask people about use of naloxone, and they will tell us how many doses they have used. So that's a self-reported indicator of use. So all of that data is collected, and Jessica may know more about the other data points. I don't know. Okay.
the orange column is just kind of the mandatory reporters, or the
I don't think it's just the mandatory reporters. I think it's mandatory reporters and self-report. We collect regular data as part of harm reduction efforts on the use of opioid reversal and the number of doses.
Could be higher.
but yeah,
Could be, it could be higher.
usage may be
Yeah.
higher than the orange column captures.
It could be, certainly. Yeah. And I can get more information from the person that provided this data if you'd like, and drill down a little bit into that number. And then,
Real quick
Yes.
thought, it might be interesting just to have that as a quarterly information for, for us as the public health authority, but just
Yeah.
to kind of share with the world.
we collect it
Do that every
regularly.
3 months or something, just maybe bring that in.
Yep. I think that's quite possible. I mean, every time I ask for it, I get it within a couple of days. So I think it's readily available.
Because if that's 6 months, we're on the trend for double doses used, and then we'll see what the rest of the story is.
Yeah.
We have a history of tracking epidemics, so this would be
Yeah.
So-
kind of continuing that practice.
So if someone has actually overdosed and they've been treated, who follows up with them to talk to them about considering having a monthly shot in order to actually get off of their addiction to opiates? Who does that?
It could be many, many different people. So if they showed up to the emergency department, we have a process where any of our open clients are enrolled in a database that if they show up in the emergency department with a substance use disorder visit, and this is all about coding, so it's kind of complicated, or a mental health coded visit, we do a follow-up with them in person, individually outreach to them within 7 days. The hospital also has some follow-up criteria for people that show up. The hospital, St. Charles Hospital, has in Redmond and in Crook County, but not currently in Bend, although I think there's some interest in expanding into Bend. They have a peer support and case manager staff in the ED connecting with people that have been treated for overdose. And they do intensive engagement and outreach with those individuals. If they come to the stabilization center, we do all the things that we do there: intensive outreach, engagement, attempting to connect them to basic needs, to treatment resources if they're willing, et cetera. And we try to stay connected with those folks. And then, of course, we have our homeless outreach services team, which also does lots of direct services to enrolled individuals, but probably serves another 100 to 200 individuals just through contacts to try to build relationships and stay connected for the moment when someone may be willing to talk about engaging in treatment. The complicating factor is, as you all know very well, treatment is voluntary, and people have to be ready to engage in order for us to be able to actually follow up and enroll them. The last thing I would say about the shot is that that is used for people that are actively engaged in recovery. So, for example, just like you can't, I'm not going to use an inflammatory example. You can't force people to undergo medical procedures against their will. So you can't force people to get an opioid, like a shot of buprenorphine, long lasting, unless they say, yes, I commit to not using and being engaged in recovery, and I'm willing to have a monthly injection of buprenorphine extended release to prevent my cravings and help me recover. So there are many, many people getting that monthly shot. But they're probably fairly well on board and engaged with treatment and recovery efforts at that point.
Thank you.
It's a great tool for someone who means business about getting well. It can take a while to get there. I'm going to I just want to talk a little bit about the Stabilization Center. We talked about this before. As you know, the Stabilization Center encounters lots and lots of folks that are struggling with substance use disorders. 40.2% of the visits include people that have a co-occurring mental health and substance use disorder. 21.9% of encounters were with people that had active intoxication when they showed up at the Stabilization Center. 80% of the people that we schedule for follow-up do show for their appointments. That is a higher show rate. So if we have people who come to the Stabilization Center and engage, and we schedule them for an intake, they show for their first appointments at an 80% rate, which is frankly higher than the average show rate for assessments. So that's a very positive indicator of the connection that's made. And we continue to see that our forensic diversion team work that's being done out of the Stabilization Center is resulting in significant reductions in recidivism in the criminal justice system. And that 60% number, I think Devi can attest, is a pretty solid performance for forensic diversion for people that are cycling in and out of the jail. I'm going to turn it over to Devi to talk about current effective strategies being used by community justice.
Oh, is it possible to get that number of people that actually sign up for the monthly shots? Is that available somewhere? I mean, I'm just wondering.
Not to us. We could get it from our medical partner, Mosaic, but that's being provided by multiple entities throughout the county. So we would need.
When you meet with somebody, let's say your team does, and they say, you know what, I really want to do that.
We can provide that.
Right. I mean, I just think it's important to know that there is help for people out there. I mean, who doesn't know someone who's overdosed lately? I mean, almost everybody I talk to has someone in their circle that's overdosed. And I really think people need to know there's something, if you can, it's complicated, but if you can realize that there is help for you, and maybe it's closer than you think.
Yeah, it's very, that treatment strategy is available everywhere in our community. And it's a good one. We just need folks who are ready to do that. And that takes some of the front end work as well.
I could ask one more thing.
Yes.
Thank you for laying out all of those treatment opportunities that people have. If they're struggling with opioid addiction, can you give us a sense of how much of those treatment efforts Measure 110 funding is kind of holding up or undergirding right now? I mean, how much was happening before? How much is happening now? And what is the impact of that Measure 110 funding?
So medically assisted treatment was happening before. It got expanded with Measure 110 funding. So in Deschutes County, for example, we were funded as part of a collaborative. If you recall, Best Care got a large chunk to open the Taylor Center. They are still opening it. So remember that the money took a long time to get here and then got here in the middle of a hiring crisis. So slowly that's been built up. All our positions, I believe, are filled at this point. I think so. Cheryl can tell me if I'm making something up, but I think most of them are filled. Anyway, to answer your question, so MAT was expanded, although it was pretty broadly available, it was expanded. The Taylor Center will provide 24/7 drop-in services at the Stabilization Center during the evening and weekends, and at the Taylor Center during the daytime, to do intensive outreach and engagement for people with addiction, mostly performed by peers and case managers, people with lived experience, and people meeting basic needs and expert in engagement strategies. It also added some more intensive substance use related outreach and engagement into the field, working with homeless populations. It expanded Ideal Options, and Ideal Options is a peer-run organization that's done really excellent work in reach into the jail. We work with them regularly. They do some work with unhoused populations. So it did expand. It mostly expanded on the front end around intensive engagement. And that's because one of the strategies or tools available to incentivize treatment declined with Measure 110, for good or ill. And so the effort was really focused on building this workforce of people with lived experience to try to do intensive in-reach into communities where there are high-risk individuals that were typically charged previously and now are not. So those were the biggest expansions. We still need more sober housing. We still need more detox beds, I would say. DB can probably speak to what else we need, but there is still need for additional treatment options. But it did expand treatment options. Ready for the next slide? Okay.
Looked like Commissioner Chang might have a follow-up.
I guess the one other question about
Yeah.
that. So early on in discussing the stabilization center with the sheriff, he emphasized and reemphasized, and we need a sobering center too.
Yeah.
I mean, it's some of the things you just talked about, the detox. I mean, does that overlap with that discussion of a sobering center, or is that a separate thing?
It's really a separate thing. A sobering center is a short-term drop-off place with medical staff that can monitor people that are intoxicated at a level where we normally would refer them to the ED, for example. Sobering centers were very, very popular. They are still in existence in some places. They have been complicated by the emergence of people presenting in those settings with methamphetamine addiction and psychosis that are incredibly difficult to manage and unsafe. Staff have been harmed physically, and they are increasingly difficult to staff. I'm not sure what the answer to that problem is. I know that it's meant that some sobering offerings have closed. So we are not pursuing that strategy at the moment. We would like to see more detox available and continue to work on the forensic side to address a certain population of folks differently.
It sounds like if 22% of people who are presenting at the stabilization center are actively intoxicated, some of
them go to the ED from the stabilization center.
got it.
Yeah.
Well, no, thank you.
Commissioner Dare. Other question?
Okay, so if you're saying detox beds, how many do we have in Central Oregon right now?
I don't know the answer to that off the top of my head.
Okay, so when we say detox, are we talking about alcohol or drugs or both?
We're talking about alcohol, drugs, the whole 9 yards.
Okay.
Yeah.
So
And know that alcohol is still killing more people than
Right.
any of the other drugs combined.
it is.
It is.
I definitely realize that. And I did ask Rick for help on where someone should go. And he mentioned McMinnville, that there was a facility in McMinnville that in Oregon, but I know so many people here that they leave Oregon to get help. There's really nothing here in comparison.
Yeah, we do have detox beds. We don't have enough for the growth in the population. And there are people who, if they detox and want long-term residential treatment, do have to go out of the area. That is true.
Okay,
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 Devi.
great. So, yeah, the effective strategy that I wanted to just chat about and that you'll see come up in this proposal is something that Janice has mentioned, and I'm sure you all are very aware of, because it's become very clear over the past 10, 20 years that working with people with lived experience, so peer recovery supports or peer recovery mentors, the terminology kind of shifts, but people who work kind of as paraprofessionals, so people without clinical degrees necessarily, but who have certain levels of certification, but their primary skill in one way in this arena is that they have lived experience. They've gone through recovery and they're actively in recovery themselves. So that seems to be very effective at the level of engagement. So if I'm somebody who's experiencing addiction, the idea is that there's an immediate affinity, there's immediate trust, there's an immediate easing off of feeling defensive or being judged for my behavior because someone's kind of been there, right? So it's a very common sense, but also we've got some evidence that does help with getting folks engaged, and with people, staying engaged. That's kind of that key piece. So recovery mentors is a huge part of all of the treatment continuum, and it can happen at any point in the treatment continuum, from the beginning, from outreach to someone who is not interested, all the way through to somebody who is coming out of intensive or inpatient or intensive outpatient or something like that. You can see them all along. So that is something that's currently happening and we see all over the place. For us, there's one little gap there, though, that's actually pretty big. And that is, Janice had mentioned it before, when you have somebody who refuses treatment, but for example, has on their condition of supervision, so now I'm speaking about people in the community justice system, you will, get an assessment and follow the guidance of the provider and get treatment. We have an odds here of somebody who does not want to do it, but somebody who the state has mandated. Many, many times, I mean, we have an issue where they cannot be helped in the system, right? They can't, as Janice said, if I decline treatment, I'm out. So we're kind of constantly stuck, and you'll see this in another section of this strategy. What do we do there? We have an obligation as the state, fulfilling these conditions, trying to support people meet those conditions. And we have a person who's saying, I have my integrity. I don't want to do this. I don't want shots. I don't want drugs. I don't want treatment. I don't want any of this.
I don't have a problem.
I don't have a problem. Perfect. So what do we do there? So we're really seeking to see an increase where we could maybe work with a recovery mentor who can bridge that gap. Somebody who maybe isn't specifically tied to OHA funding and billable increments. If I don't have somebody who's enrolled in a OHA DMAP system, behavioral health could not use their recovery mentors for that individual to help somebody in our system who we know needs help, but is not yet ready to get it. So we're really excited to bring the science and bring the anecdotal evidence of what works with peer recovery mentors into that population that is falling through the funding gap, which makes it really difficult to serve them. But with this established practice of peer recovery mentors. So just kind of see up there on the top, the 3 poles of recovery support that I really love: culture, community, connection. I mean, we're talking about not just I'm an individual and, Commissioner DeBone, we have this shared use history, but also how can I, as the recovery mentor, help you connect to what's important to you culturally? What is your heritage? Does that bring some meaning to you? Do you have a really good memory of something that you did with your family, your grandparents? How can I connect you with that? So that's not you becoming dependent on me, but me through a non-judgmental relationship, helping you find something that grounds you in a positive, pro-social, meaningful way. And similarly, community, sort of how can I connect you with things in the community that aren't me, that aren't behavioral health, that aren't community justice, that aren't this professional official relationship that we have, but that are actually you being a productive member in society. And then that connection, that's just sort of that's probably connection should probably be at the top, because I think that's the magic of the peer recovery, which is I see you as a person, you are a human being, I'm a human being, we're going to kind of get through this together. So those are some of the elements of peer recovery mentorship that we really see as beneficial and effective everywhere you see that term. But through these funds, we're really excited to maybe see if we can get some of that good work going when the person is not formally enrolled or able to be billed to OHP or OHA resources.
Yeah, I mean, the other thing I would add to that is I think one of the things that peers really offer is hope. And what I've experienced in my own life with people I knew that struggled with addiction, and also in my professional life, is that there's a there's a real loss of hope and self-efficacy that can occur. And people can really begin to believe that there's just no way out of this trap of addiction. And what a peer can offer that I can't is a window into a journey that led to recovery and actual evidence that it can be done. And that's really hard to quantify, but there is a study. I did share it with you on this slide because Stevie shared it with me. That really does demonstrate that peer interventions reduce relapse, increase treatment retention, and improve relationships with providers. So nice to know that there's some evidence behind what we observe in the field. So let's get to the proposal. What we're proposing is a multi-strategy 5-year collaboration. So we're just proposing a plan for the next 5 years for utilization of funds. After that, at some point in that final year, I think you as commissioners or the commissioners at that time will come back to the table with health or with others and think about what to do with the funds going forward. But for now, we're proposing adding targeted expert opioid use disorder prevention services, expanding the coordination of surveillance and overdose prevention activities, sustaining existing crisis interventions, adding direct case management and coordination for this forensic population, a very targeted population, and adding recovery peer intervention services. I'm going to let Jessica start on slide 10. Next slide.
Great, thank you. So this title of the slide is a really great summary of the work that this particular strategy will address, which is targeted prevention, surveillance, and coordination. And you can see in this slide the goals that we seek to address are improving awareness, preventing and reducing use, improving coordination, ensuring real-time surveillance. I'll talk a little bit more about those in a moment. On the right side of the slide in the green box are just summarizing how this particular strategy aligns with the allowable use of opioid settlement dollars and then the cost of this strategy for over the 5 years below. We're proposing to add a new FTE, a community health specialist level 3, and augment the existing FTE of a supervisor at 0.2 level, and then the remainder being materials, services, and indirect cost.
And materials, just to be clear, include multimedia campaigns and the contracts that are associated with that and the materials that are associated with that over a 5-year period.
Yes, our awareness media can be expensive, and we often need graphic design assistance embedded in contracts. So those are helpful. In this slide, we get a little bit more specific to the activities. So the first item is really about community awareness. And when I speak to that, I mean general community awareness. So it's information that all people see about resources that are available, providing reassurance to the public, but also very targeted messaging, which is a very different type of information dissemination. So we want to make sure that our high-risk populations and areas that need resources and understanding of this issue have that. So it's a really a more comprehensive community awareness when we're talking about this. We also want to make sure that we assess and make sure that naloxone is being distributed, as well as naloxone training. We know that it's being distributed, we're just not sure if it's enough. Are the populations and areas that need it getting it? And so what's that situation like? We'd like to address that. And Janice mentioned this prior, but really that collaboration across the systems to work toward this issue is engaging with Cooper, the Central Oregon Overdose Prevention and Response coalition that involves a group of people that have expertise in law enforcement, healthcare, behavioral health, prevention. And so we just really need to be working together in a coordinated fashion so that we don't have this set of resources going this way and this going the other direction, but that we're all headed in the same direction to address this issue. The last 3 bullets on this slide are really speaking to data and understanding. And so we, as a slide prior in this presentation, spoke to are just at the tip of the iceberg. So we need to be able to actively be monitoring the situation, understanding risk factors, modifying our activities to address them. So that's speaking to that epidemiology, surveillance, and really understanding the root causes. I want to highlight the real-time surveillance, our ability to, as has been noted in discussion just earlier, to have a quick response to an overdose death is compromised by the lag time that we're seeing in the state getting back to us, validation of a suspected overdose. We would like to propose, and we have actually very productive conversations with our medical examiner who works in Deschutes as well as Crook County, to replicate the system that we're using with suicide death, in which the medical examiner populates an app that Deschutes County IT developed in partnership with us. Shout out to Eric Ballinger. We'd like that system to be utilized in the situation of suspected overdose deaths, so that we can, in a very timely manner, receive that information, assess what's going on, get some communication out to the population, the workplace, the whatever environment is impacted, to have information, but also a response so that we can be minimizing further death and destruction. So that we think is very possible and are working toward that. So in the next slide, you'll see what we seek to achieve just in the first year. So our measured outcomes, and we'll continue. I'm not going to read these to you, but each year we will create measurable objectives. These are the first year's that we seek to achieve, and they really are rooted in what we're in those activities that I just described to you, and we'll be modifying and adapting and adjusting as we learn about the data that's coming in and learning about the needs of the community. So this is something we could report back to for sure, and we will be developing new objectives as we move forward. Any questions or anything you want to add?
No, I would just say that the outcomes are really where the rubber meets the road. So while we're not reading them aloud, they're actually what you buy with the dollars, and they matter a great deal. So we worked very hard to have very concrete, measurable things that we can achieve with the resources invested, if you choose to decide to invest in that way. So we hope you pay close attention to those. And in the
Thanks
interest
for
of
explaining the surveillance tool, what we're talking about there.
Yeah. Yeah.
Saw the bullet. Now I know more about what we're talking about.
Yeah. Next, okay. The next set of strategies are really in the more targeted intervention lane. So the goals of those strategies are to divert individuals from the ED and the criminal justice system, to prevent death by overdose or suicide, to connect individuals with treatment and help them stabilize in their community to improve quality of life, and to coordinate services to community justice population by providing focused, targeted case management and warm handoff referrals. This relates to the allowable use that specifically calls out support for crisis stabilization centers that serve as alternatives to hospital emergency departments for people with opioid use disorder. or other substance use disorders. We're proposing to support general operations of the stabilization center, but specifically as part of that investment to add 1.0 FTE, a behavioral health specialist case manager, preferably with a certified alcohol and drug counselor certification. And that person would be specifically embedded at the stabilization center and with the Department of Community Justice to case manage a population of individuals identified as DV described. So people that are on conditions of probation or parole and are not engaging, and we are working actively to engage as part of conditions of their community agreement for safety. The additional strategy involves the Department of Community Justice putting out an RFP for a peer-run organization to provide additional intensive pre- and post-release access to peer-based reentry support for those particularly returning from prison, to ensure culturally responsive services through training and professional support of community-based peer support specialists, and to serve this shared population through peer support services. And that really relates to the allowable use of connecting people to peer support services for intervention. Next slide. What those folks will do is receive services through the stabilization center specific to substance use disorders. This includes walk-in substance use disorder assessment and case management, naloxone, fentanyl test strip distribution, referrals for SUD and mental health treatment, and after hours and weekend behavioral health resource network drop-in services. The outcomes that are specifically going to be measured are that the stabilization center will develop an EPIC workflow. What that means is a workflow in our electronic medical record, which sort of guides how we ensure that we're engaging in targeted interventions, to document crisis substance abuse treatment related referrals so that we will be able to report back to you, this is how many people showed up that identified as intoxicated or with a substance use disorder. This is how many people that we referred, and we are working on a way to see whether or not those individuals followed up on their referral. In other words, did they show for the warm handoff referral or for the appointment that was scheduled? They will also establish a crisis SUD referral baseline in 2025.
But Janice, as you said.
Yeah.
Sometimes people have to go through this many times
Yes.
in order to get off drugs. So just knowing that they showed up once doesn't really solve any problems if somebody goes through, trying to get off drugs 5 or 10 times. I mean, you read those stories all the time. So when you just say you're going to follow up, I mean, to me, like listening to the peer work, it's got to be for quite some time
Yeah.
to know that actually something is working.
Yeah. No, you're absolutely right. And I love hearing you say that back to me because it shows that our efforts to sort of talk about what this looks like are really landing. What I can say is that showing up at all is an important first step. So there are people who never show up and they may die or continue to have terrible consequences as a result of addiction. So showing up is step one. Showing up 3 or 4 times, maybe step 2, 3, and 4. What I've said to you before is that most people do ultimately recover from addiction. Most people ultimately recover from addiction if we can keep them alive long enough, if we can stay engaged. There is actually light at the end of the tunnel, and many, many people recover. So we're in it to the finish line, and that means saving lives. That means engaging over and over again, even when everyone else has given up on someone. So you're right. Tracking referrals is not the end of the story. Tracking referrals is really tracking a mid-level metric of how effective we're being at getting people connected to services. Good call out. So as part of that, we will establish a baseline. How many people have we been referring? Are we increasing those referrals? On the next slide, slide 16, we talk specifically about the case manager role. That person will support shared clients between the stabilization center and probation and parole, and potentially other teams as well in behavioral health. It will act as a liaison and point of contact specifically for our probation and parole colleagues in order to enhance the collaboration and coordination on those individuals. The Community Justice Peer Services contract will increase the capacity to provide responsive services, culturally responsive peer reentry support for individuals with substance use disorders, in particular who are releasing from prison. And specifically, those services will involve picking people up at prison. Many people release from prison and have nowhere to go. There is no one to meet them. There is no plan or a very substandard plan for maintaining sobriety and being connected in the community. Pre-release medication services and housing coordination, i.e. helping them leave prison with a plan. Post-release transport to meetings, appointments, and community and cultural activities to keep them engaged positively in the community. Accompaniment to health and SUD-related appointments and needs. We know that compliance and treatment goes up when your peer takes you to appointments. And connection with employers to help open the gateway for work for people returning to the community.
So are we talking about Deschutes County residents?
Yes.
Are we talking about Deer Ridge? Are we talking about when they leave a different prison in the state and we're going to go and meet them?
We're
And
talking about anyone who leaves incarceration and returns to home in Deschutes County.
okay,
So they could come from anywhere, but if this is their, when you release, you have to identify an address and a place you're going to land. And if they're landing here and they are high risk for relapse and substance use, that would be a population that would be targeted for this intervention, this set of interventions, case management and peer support.
So we actually do that now? We go and pick someone up, DV?
We do not. I mean, the parole and probation officers try to coordinate and make sure that it happens. Every once in a while we will, but we might often maybe give a bus pass or, if somebody really can't make it. But usually we're trying to coordinate with family members or friends or somebody that's approved. But this would allow us to, and when those fall down, to bring somebody there, because a lot can happen between release and getting into our office. And that's usually the requirement, is to report to parole and probation like immediately. That's the first thing you have to do when you come into Deschutes County.
And that's really consistent, like what our community justice partners are really discovering and beginning to make use of is what we've been learning about in behavioral health for a long time, which is that to take a master's level behavioral health specialist and have them deployed to drive here or there to do various things may not be the most cost effective or even the most engaging way to bring people into care and services. And so having a group of folks who are peers, who are really truly community-based, and we don't necessarily have to worry about how that cost gets covered because there are dollars to cover it, expands and amplifies your ability to intervene with people pretty significantly. So that phenomenon that you're describing is the same that we've encountered. Okay. Measured outcomes, the case manager will engage 30 shared clients in fiscal year 25 and increase by 5% each year thereafter. And we hope to reduce visits to the stabilization center, emergency services, and jail as a result of substance use disorder crises. So last note here, slide 17 refers to how these efforts leverage existing efforts. So we really built this strategy into what's already there and working to try to amplify what we have. I mentioned the Pain Standards Task Force. Jessica has talked a lot about Cooper and how that real-time data is really promising. We have our emergency preparedness team in public health that manages health alerts, including maybe the capacity now to provide health alerts related to substances that are creating a real risk in the community. Our CCBHC, you're very familiar with, but CCBHC involves offering medically assisted treatment for opioid use disorder, offering substance use disorder treatment, offering targeted case management, peer support services, and all of those things. So this is adding in a layer of additional sophistication and targeted efforts to that. Our harm reduction program is making real inroads into reducing death from overdose. And our host team, of course, is working closely with many at-risk folks struggling with substance use disorder in the unhoused population. And our community justice program already has some successful efforts at engaging this population, and this is an expansion on that. So that's our proposal. It is 5 years of funding. It is a total of $3.4 million, covering the cost of FTE, contracts, materials, services, supplies, and indirects. And I put some references at the very back.
When I look at this slide, the ending working capital goes up. Can you explain how that? Because that,
The orange line,
yeah, so my understanding was, kind of surge of resources and then it was going to go flatline, the money coming in. So how does that?
that just represents that we didn't plan to spend any of the money 5 years from now unless we get to that point. So I would say in the final year of this 5-year program, we will be looking at what efforts have been successful, what dollars are remaining, what can be expended. And remember that the dollars really change in those out years because they come year by year. And
Mhm.
so the flexibility with which you can use them really changes. And I think that's a point in time where this board or the sitting board will really need to be thinking about, if we only have 200 and some thousand or 300 and some thousand a year to use, how do we best apply those dollars? And we hope that through these efforts, we have mitigated some harms and have a better sense of where the investments need to continue going forward. So that's why.
Got it.
That rising orange line basically represents the funding that's available.
That represents the funding available,
Or decisions
unplanned
to be made
at this
later.
point. Yeah.
But and there's surge money, it's already in the bank, larger amounts coming up front. But that's just
Yeah, there's a
got
big
it.
chunk that
Helps.
was unspent that made the upfront investment possible.
Yeah.
And there was a big one-time lump sum from one of the pharmacies that came, I think, this year or last year.
Mhm.
So it just made the initial amount available significant.
And this one pager that was handed out.
It just summarizes. We covered a lot of information. I wanted to sort of pull it together on one page to say, this is where we are. This is what's working. This is what we think we still need. And this is a summary of what we're proposing to do with the dollars.
Yeah, okay.
So the 1.8 million for the stabilization center, then how will that be funded the next 5 years? Is it an even amount? Or is it?
It's very little this year. Starting next year, we hire the case manager so that we push that out a little bit. And we add whatever the difference is between 440,000 and the cost of a case manager, which I think is roughly
150.
I'm going to let Cheryl come up and give you budget details.
And on this chart, it's the funds going into the stabilization center is part of the blue chunk of this bar.
Yeah.
These bars.
Yeah, so the stabilization center, we already talked about the one FTE, which is right around 120,000 annually for 4 years. This year, the stabilization center would receive about 35,000. And then for the next 3 years, so fiscal year 25, 26, and 27, it'd be 300,000 annually.
And the other amount for the case manager.
Well, so yeah, thank you very much for this proposal. I know when we spoke about this last, I really wanted to see if there was going to be any input or feedback from the Public Safety Coordinating Council, the people at the table there, and that happened pretty quick. So that was a while ago. And also talked to the courts, one of the judges over there, and really talked about what could be done, or any thoughts there. So we took a little survey of kind of the world around us. This is a mature, well thought out ask at this point with these dollars. And, I'm very comfortable with where we're going here. It's, at the court system, they say, and I think maybe Steve Gunnels at the DA mentioned this, that, years ago, the methamphetamine crisis was really bad. This is worse. So, when you hear about that, you're like, oh, this is serious business. So we really need to provide some community education and support for anybody who gets stuck in this trap.
And it's really sad to see that Family Drug Court, they're having their last graduation. I mean, that was a program that worked, and unfortunately, it's not going to be continued after this graduation, I believe, according to our email. So, yes.
Yeah, I really appreciate the addition of the recovery mentors to the package that's being presented to us. We have been talking about this for 4 months. And so I do hope that we can move forward today, as was made very clear from the data that was presented. The opioid addiction crisis is urgent and becoming more urgent by the day because of fentanyl. And it would be great to start to deploy some of these resources that we have access to address that. So with that, I would move approval of the recommended use of opioid settlement funds over the next 5 years.
Do we need to allocate the dollars? In the motion?
If approved, it'll come back in as a resolution
Okay,
and we'll put it on consent agenda unless the board wants it as an action item. But otherwise, we'll put it as a consent agenda item.
okay. So I second the motion and I do want to add the comment. Thank you, Davey, for bringing in First Light Lorenzo for our discussion. I think that's incredibly important. His work, his team's work.
Okay, it's been moved and seconded. Thanks for the comments. Anything else? Seeing none, Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And chair votes yes. Thank you so much. We used up all the time and then some, but it worked out really well. We got, no, not a problem. That worked out wonderful.
That we had that extra time.
Yes. Thank you. Item number 7, second reading of ordinance revising Deschutes County contracting code.
Yes, Commissioners, this is the time for second reading and adoption of ordinance 2023-012, which provided for some revisions to Deschutes County Code sections 2.36 and 2.37. There have been no changes since the first reading. I do note that I believe the ordinance in the packet was an error, but the ordinance that the board would actually sign provides for an effective date of January 1st, 2024.
And that, yeah, mine reads that way. Okay, is there a motion?
Move second reading by title only of ordinance number 2023-012.
Second. Any other discussion? So seeing none, Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. This is the second reading by title only of ordinance number 2023-012, an ordinance amending Deschutes County title, an ordinance amending title 2.36 and title 2.37, contracting of the Deschutes County Code.
I'll move adoption of ordinance number 2023-012.
A second.
Any other discussion? Seeing none, Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And chair will vote yes, it's been adopted. Thank you so much. Item number 8, this is first reading, proposed first reading of ordinance number 2023-015, plan amendment and zone change.
Good morning, Commissioners. For the record, Anthony Reedy, Principal Planner. Before we get to potential first reading, I think the board is aware that the staff and legal counsel have made some revisions to the decision. In the past, what we've done is sort of discuss the revisions, and then if the board so chooses, there can be a motion to accept or modify those revisions. And then assuming that the revisions are accepted and the motion passed, then there would be a motion for first reading of the ordinance by title only. So with that, we can talk about the decision generally, or we can go right into the revisions.
So Exhibit G is what we're talking about here, went from the original packet,
Yes.
and there's some slight amendments to that.
Yeah, the first one is a Scribner's error on page 2, where I had the incorrect dates of the open record period following the close of the public hearing. So that's a fairly simple change.
I did find one parenthesis on page 15, and I asked Dave to look at it, and it's in the second paragraph, and it's there alone, so maybe just that needs to be removed.
Oh, yes. The first paragraph of the first sentence of the last paragraph. I see.
Well, it's the second paragraph on page 15 that I was looking at. That was, okay.
Yeah, the first
find it
sentence, there's an open parentheses, but no closed parentheses, so.
Right. I know. I was like going, where is it
Yes.
closed at?
Yes.
I was like, where should it go?
Yes.
Okay.
So as I say, my thought process was, this is, the title of this is Board of County Commissioners of Deschutes County, Oregon, finding on fact and conclusion of law on remand. So my question is, I mean, is this like the final package now? Because there was a previous decision of the board, there was a previous decision of the hearings officer. So this
Yeah.
Exhibit G
Yeah, so
is the
this
work
is,
product we're creating right now.
yeah, so this is the board's decision, really addressing the LUBA remand and then the public hearing, the arguments on both sides. So
Well,
this is your
so I
final
guess,
decision.
so my thought, this is an all-inclusive answer though, too. I mean, you can go read everything else, but this really has all the content in it. That's really what I was trying to get at. So
Yeah.
we don't need to go. Yeah, I'm just,
Yes.
whoever's
so-
following this topic, I guess
Yes.
is what I'm referring to.
Yeah, so the remand decision references your original decision and also references the hearings officer decision. So you're correct, Commissioner DeBonne. This is the entire package for the plan amendment zone change.
So as I say, it was a split decision. And there's the proposed slate edits right now. So Commissioner Adair, are you comfortable kind of receiving these edits for review right now? And then we'll see where we go.
Well,
with
I
this.
came in early and read it all.
Well, yeah, no, but I mean, officially receiving them
Yes.
at the board meeting is what I'm referring to.
Exactly.
Yeah, so as I say, I was looking for the underlined edit items. If you can go through it, is it,
Yeah, so page 2 is the simple, again, that's the Scrivener's errors regarding the date. And then the substantive changes, the other changes are on pages 18 and 19 of Exhibit G. And you'll notice on page 18, there's a new paragraph which more fully explains the updated EC analysis and its addressing of the OAR regarding conflicting uses. And then on page 19, it continues that sort of theme and reemphasizes the applicant's voluntary agreement to have the LM zone apply during the development review of the subject properties in the future. And again, if the board so wishes, there could be a motion to accept the revised decision as amended and discussed.
I move to accept the revised edition as discussed, page 18 and 19. It's what, referring it to as Exhibit G?
Yeah, Exhibit G is the board's decision on the LUBA remand specifically,
which is this document?
the document that you're looking at right now.
Yeah, what are you referring to when you asked that just now?
No, I just
Which-
said,
which-
I move acceptance of
Oh,
the,
the whole thing is,
Big-
oh, okay, I
yes.
thought you were referring to some words in here.
no. I just was referring to the major changes of the document.
Yeah, so as I say, I saw the email last night and I'd just like to take a moment and review page 19. I was able to look at 18, printed out right before the meeting.
I guess if there's a pause, I'll just say, I do not believe that this decision gives adequate consideration to scenic resources in the county. I don't believe that the original decision gave adequate consideration to agricultural resources in the county. So I will not be voting to support this decision.
Yeah, so I'm comfortable with what we've stated here. And I was able to review the previous document yesterday. So it's been moved to accept this update for today, and I will second it. Any other discussion? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang,
No.
and Chair votes yes. So one of the items that came to me recently is the out in Alfalfa, a marijuana farm that put a big fence around its property, put many big greenhouses up, had a big, large structure out there. And controlled, very much controlled access to the property. So what could happen on EFU could be as large or bigger than the activities here. So it's just a reference point for me when I go see that.
That is a significant visual impact, but a pulp mill, for example, is quite a bit bigger.
Well, as I say, I mean, when it comes to a pulp mill, that is a high volume, high water use, operation that, I mean, it could be, it's in our code to have to review it, but the probability or possibility of a pulp mill.
One of the allowable uses in the rural industrial zone, and it is essentially the way that the EC analysis was done. It was lumped together with a bunch of other, a whole spectrum of potential rural industrial uses. So,
What does it say? It'd be conditional. And if there was water for that, that would be a whole new discussion. Okay, well, good discussion. No, thank you very much. So at this time, it's been accepted, the edits as proposed.
And so at this point, if the board wishes, you can move to first reading of ordinance 2023-015 by title only. And then I'll be back before you in 2 weeks for second reading.
Okay.
Move to first reading of ordinance number 2023-015, the LBNW LLC plan amendment and zone change
By title only.
by title only.
Okay,
Thank
you
you.
very much. And I will second it. Is there any other discussion? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang? No. And Chair votes yes. So at this time, ordinance number 2023-015, first reading by title only, an ordinance amending Deschutes County Code Title 23, the Deschutes County Comprehensive Plan, to change the comprehensive plan map designation for certain property from agriculture to rural industrial, and amending Deschutes County Code Title 18, the Deschutes County zoning map, to change the zoning designation for certain property from exclusive farm use to rural industrial. Second reading in 2 weeks.
Thank you, commissioners.
Thank you.
And I will say, total non sequitur, I'm looking forward to hearing and seeing the wisdom from David Doyle as he's on a panel at the Legal Issues Conference coming up. So I'm very excited to see and hear that. Mr.
Oh,
Doyle.
They lowered their standards.
no.
I don't think so.
A lot of experience there.
Thank you, commissioners.
Thank you. Item number 9, second reading of ordinance to 2023-018. Amendment.
Good morning, Commissioners. For the record, Rachel Vickers, Associate Planner with the Planning Division. The item before us today is a second reading for an ordinance approving a plan amendment and zone change for a piece of property of approximately 40 acres in size east of the city of Bend. The file reference number is 247-22-000-792-PA 793-ZC. In your packet is a draft ordinance, is a draft of ordinance 2023-018 with exhibits. These materials have been reviewed by planning staff and legal counsel. Today's meeting is a second reading, and if approved, this ordinance will become effective 90 days from today's date, which is November 29th, 2023. Staff is available for questions. If there are no questions, board may move approval of this ordinance as written.
Great, thank you so much. Is there a motion?
There have been no changes, correct?
Correct.
Okay, great. So I move approval of a second reading of ordinance number 2023-018 by title only.
Second. Any other discussion? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes. So this is second reading ordinance number 2023-018, an ordinance amending Deschutes County Code Title 23, the Deschutes County Comprehensive Plan, to change the comprehensive plan map designation for certain property from agriculture to rural residential exception area, and amending Deschutes County Code Title 18, the Deschutes County zoning map, to change the zone designation for certain property from exclusive farm use to multiple use agriculture.
And I'll move adoption of Ordinance number 2023-018.
I'll second it.
Any other discussion? Seeing none, Commissioner Chang,
Yes.
Commissioner Adair,
Yes.
and Chair votes yes.
Thank
Will be
you.
effective 90 days. Thank you. Now we're getting through the agenda. Item number 10, Historic Landmarks Commission update. Historic Landmarks Commission. Front page of the paper today talked about a historic building in Lapine.
Outside of the county jurisdiction.
Outside of this one. Okay. Thank you for the clarification.
Good morning, commissioners. For the record, Tanya Saltzman, senior planner. Excuse me. Yes, I'm here to talk about the Historic Landmarks Commission. A week or 2 weeks ago, I think it was, Peter Gutowski provided a little teaser on sort of what we were going to come to the board to discuss. First of all, I'll just give a really brief overview. I am the staff liaison to the HLC. That's why I am here. I've been doing that for a few years now. The HLC works basically for the rural county as well as the city of Sisters, and that's been that way since 2011. City of Bend and Redmond have their own HLCs, and they do their own thing. And the HLC is the legal basis for it is established in the comprehensive plan, and the Deschutes County Code at Chapter 2.28. With Sisters, Deschutes County is considered a certified local government, CLG, and you've had me come before you in the past to talk about grants. There's a biannual, I think it's biannual, a CLG grant that provides some funding that historically the county HLC has been awarded for various types of projects. Most recently, things like the strategic plan for the HLC and the policies and procedures manual. So that's been great. And that's there's a few criteria that make something a CLG by having a Historic Landmarks Commission, certain language and code, that sort of thing. Which brings me to our latest membership and recruitment issues. So in the spring, we had two of the commissioners resign, and one longtime member, Commissioner Sharon Lechte, passed away, which was very sad. Where she was a fantastic person, but so that led us to have 3 vacancies. We initiated recruitments for those 3. Due to a very low interest, we had to extend it a couple of times. Ultimately, the final round of recruitment closed on August 15th. So in that time, we did receive 2 applications for those 3 open positions. That was basically from May to August. So a pretty extensive recruitment process. We reached out on social media, kind of spread the word through networks. I think Commissioner DeBone might have plugged it at a meeting or 2. But unfortunately, yeah, there you go. Unfortunately, it didn't generate a ton of response, although we are grateful for those 2 people who have provided their applications. So unfortunately, we're coming to the realization that there hasn't been a ton of interest and activity in the Historic Landmarks Commission as it stands now. And I want to say that this is not saying that people are not interested in the history of Deschutes County. There's obviously a very rich history, and there's a ton of people in the cities and the county who are very engaged in historic preservation, having events and outreach and things like that. There's just not particular interest in the HLC itself. And some of that is just because of its inherent limitations. It's addressing pretty much only the rural county and a little bit of Sisters. It's technically a review body. So when applications come before us to alter a historic resource, that would be what triggers the HLC. We haven't had one of those in years. Additionally, any sort of nomination as a locally significant resource or a national register type thing, that would come through the HLC as well. And as noted, we haven't had those either recently. And that's also tied to the fact that a lot of these resources are private property. So in theory, if you're the owner of a historic resource, you're not obligated to either, nominate it. It's up to you as the property owner. So we can't, as a county or an HLC, force somebody to do something, to nominate something, to get it on a list, to even repair it. So there is that tension that keeps that activity relatively low. And just the nature of being a county commission, because rather than a city, you know, there's not as I think I said in the memo, critical mass, as it were. There's not a historic district to walk through. There's definitely a ton of resources. They are spread out, but it just contributes to sort of a lack of momentum with the historic resources and the tasks involved taken on by the HLC. So with that, staff has prepared kind of a recommendation for board consideration involving the disbandment of the County Historic Parks Commission as it currently exists. And I've outlined what that actually entails in the memo. And I just want to emphasize that staff has not provided this recommendation lightly. We recognize that this has been a tradition in the county for a really long time, and that there are people who have devoted a ton of their time and resources to this. So this is something we've kind of struggled with, but it is coming to that natural place. So this is staff's recommendation or potential path. So the disbandment of the HLC would involve a little bit of code amendment to delegate those reviews, if they came up, to the planning division. Depending on the type of review, it would either go through a quasi-judicial process if it's an alteration, so a hearings officer and then the board potentially, or through if something was a nomination, that would go through the planning commission first. So there's still a path for those actions. It just wouldn't go through the HLC. So nothing in that sense would necessarily, nothing would be neglected. Nothing would go away. It would just change.
A little bit of clarity here. So
yeah.
you're referring to alteration or development activity on a registered resource, or nomination of something to be a registered
Correct.
resource.
Yeah.
Those are kind of the two action items that could
Exactly.
happen.
Exactly. Something new that might be put on a list, basically, either the local list or the national list, or an alteration. And as I've noted, those have been few and far between. We still possess the resources to address those things should they arise through our planning division. So that would still have the additional rigor that is recognized and required for those kind of processes. We would retain in the code chapter that talks about the HLC, we'd retain its reference to the HLC, but acknowledge that if there's an HLC if the HLC is not appointed, it would go through the planning division. So in other words, we'd place both of these options in the code. So if there were changes going forward, we wouldn't necessarily have to amend the code again, just to make it a little bit cleaner. The county would no longer be a certified local government, and we have been in brief discussions with our state representative, Curry Gill, who's fantastic at the Office of State Historic Preservation, to kind of figure out how that would shake out. We are currently in the process. We have a CLG grant right now, but no funds have been spent. So I would imagine that that's not going to be an issue, probably just some clerical administrative work, but there's no dollars that have been spent thus far. And we've been in touch a little bit with the City of Sisters, of course. They would have to take on their own historic reviews the same way the county would through the Planning Commission or the Planning Division. So we've alerted them to this potential. And lastly, the door is not completely shut. It just temporarily might close. There's always an option to reconvene if something bubbles up, whether that's a particular property that generates interest in preservation or nomination, or just general community interest. These things can always be resurrected fairly simply. Obviously, there would be recruitments and things like that, but it's not closing that door forever. It's just temporarily while that interest is relatively low. So that's staff's recommendation. I don't know if anybody from Peter's at the edge of his seat. I don't know if you have anything to say. But Peter has a long and storied history with the HLC and a deep admiration for all the work that they've done as well.
I wanted to ask one question.
Yeah.
So a few years back, there was, in one of the battles over piping one of the irrigation canals,
Yes.
there was a push to designate a chunk of canal on the National Historic Register. Was there any role for the Historic Landmarks Commission in that process, or did they weigh in? Were they kind of in the middle of it? Were they peripheral to it?
That was before my time.
Sure, I can respond. Peter Gutowski, Community Development Director. Thank you, commissioners, for the opportunity to speak. There have been two canals that have been successfully nominated and are now listed on the National Register of Historic Places. The first was the Pilot Butte Canal. National nominations, if you have a functioning certified local government program, which we still do today, and we did when the Pilot Butte Canal first came forward, as using that as an example. The Historic Landmarks Commission and the Board of County Commissioners each have an opportunity to offer feedback to the state. It's a state decision. The State Historic Preservation Office has the State Historic Advisory Committee. I always forget the acronym, but they have a committee that oversees that agency. They send out notice for public comment. Commissioner DeBone will remember, and I can't remember if Commissioner Dare, if you reviewed the second canal.
I believe so.
Yes.
And I know someone with one of them that they're gone. Yeah.
They
Even though they got the designation.
45-day period. And so CDD, in coordination with both commissions, the HLC and the board, ultimately provided feedback. And for those that might be watching online, both commissions expressed reservations about the listing of that canal, as did the irrigation districts and other parties. Ultimately, those comments were, while they were considered, they didn't persuade the state's committee, historic committee, to recommend the listing to the federal government. And the federal government ultimately ruled, based on the findings, that those two canals should be listed. So there is a process, as I've articulated. It's really rare to have a listing, a federal listing of a canal. I think that the Deschutes Basin Board of Control, Central Oregon Irrigation District has proactively identified through a multiple listing process. You may recall Commissioner DeBone and Commissioner Adair that they've done a sweeping assessment of their systems. And so all things being equal, I think the likelihood of listing another canal on the National Register is low, but nonetheless, there are these experiences that serve potentially as a template. And going forward, to the extent that the board was supportive of us initiating an amendment that looked at disbanding the HLC for the time being, to my knowledge, only the Board of County Commissioners would then have the opportunity to respond to a national nomination proposal, because we wouldn't have a functional historic landmark commission. So to that extent, the local governments, the Deschutes County, would still have the opportunity to weigh in on such a situation if it presented itself going forward.
Thank you.
Well, it's just a reminder that Tanya, you mentioned that, a private property owner would need to participate and want to participate, and that wasn't the case with the operator and owner of the canal. So. Ugh.
Yeah, the other thing that I would offer, just for context, I've served in Tanya's role for several years, and want to echo the incredible contributions that our land commissioners have offered. Many of them, unlike the Planning Commission, they don't have term limits. So we've had members on this commission that have served for over a decade, and their contributions are duly noted. The way that Tanya has framed it, we have reached a new period in Deschutes County. And as I mentioned a few weeks ago, I think we're one of, right now, maybe 2 or 3 other counties. I think Benton is one of them that have a certified local government grant program with a functioning landmarks commission. I think that's indicative of just the realities of where historic assets are located for the public to access and enjoy. And the other piece, and Tanya and I talked about this in the hallway before we came over, whilst counties don't necessarily have these functional certified historic preservation programs, they have historical societies. And I offer that because even though
right, we're having a conversation about disbanding the Landmarks Commission for the time being. We have a historical society that provides incredible resources. The board has been, and the county has been, a huge supporter of them. And that they have a wealth of information that's accessible to the public that speak to our historic, our past, much of which is historic, and that's still available. And I think that's how other counties throughout the state promote their history and their lineage, is through those societies. So when Tanya noted that, I thought it was worth highlighting, because we are not in any way trying to look the other way. There's a lot to learn from and a lot to celebrate, and that facility and those resources and the staff overseen by Kelly Cannon Miller, they're extraordinary.
As well as the Three Sisters Historical Society as well. I think there's been a little bit of kind of frustration, that might be too strong of a word, but in kind of like, what is the stuff we can do as the HLC? And it is, unfortunately, just the way it's structured, it's a little bit limited. In theory, they could do events and outreach, but that it's not one-sided. It can't just be staff. It can't just be the commissioners. It has to kind of, there has to be this magic, the magic energy that comes from that. If the HLC were to take on those type of things, events and things like that, publications. So, it's really in the wheelhouse of these historic societies, and they're really good at it. And I think there's definitely a lot of cross-pollination. So I think that there's still a place for, learning about the history of everything. We're not abandoning that. I think it's still going to be well taken care of.
So the proposal is to start a process if there's support today.
Correct.
Because then the community, as I say, when I think of Historic Landmarks Commission, if we had a queue of 2, 3, 4, 5, or 20 properties or things that were the focus areas, man, let's go do it. And that's what it's been like for the last few years. There just isn't any real activity, any properties or cultural resources that are popping up in this domain right now. But my point is, this process it could go the other way. We could find out, hey, let's all talk about this, and maybe the community is going to come up with something.
So were we actually awarded then 5,500 for this year?
Yes, but none of it has actually
Been spent.
Yeah, we haven't spent anything. We haven't requested anything. So
we will return.
Accounting wise,
if we go forward, then you would return that funding.
Yeah, we haven't received it yet. So
you haven't received it because
you do it. You report every quarter.
Reimbursable grant.
Yeah, exactly.
Oh boy.
Exactly. So that no one's on the hook for that right now.
I mean, was the scope of work for this year?
It was smaller than it has been in the past. In general, it's been, roughly
$10,000, wasn't it?
$15,000. This year, we only asked for 5,500 with a in-kind match of staff time, and that was primarily with the City of the Sisters project.
I was asking more about the scope of work. Like, were there really meaty, urgent things in the scope of work for this year that it would be sad not to see happen?
I think it might be sad, but they weren't urgent. If that's they were not, it is a bit, I'm going to be perfectly honest, a bit of a reach sometimes to find projects that are
we're kind of making projects up.
Yeah. I mean, I think we've done great work with the stuff the resources we've been given, but it's not critical projects. It's just kind of nice to have projects.
Sounds like it's okay to let go there.
Well, so is there support for the proposed kind of steps that are in this memo, knowing that this will be a public process also, because it would be amending Deschutes County Code?
Right. It would be the way we've put it out here. It would be just a work session with the Planning Commission and then a hearing with the board, just a legislative hearing.
I'm getting indication from the back. Somebody wants to speak on the matter. Is that what you're? Yeah. Okay. No, this isn't. So this is before a public hearing on the matter. This is just kind of talking about the topic. So, and Doreen, I know you know how to get a hold of me, so you can communicate. But yeah, this is just putting direction to it today. Is there support?
Yes.
Apparently, I actually asked somebody yesterday to contact you.
Oh.
She's always asking what she can do. And I said, well, we really need somebody for this board. But apparently,
I mean, it's, and forgive me if I'm beating a dead horse, but it's kind of twofold. It's one, having the people who are interested in, but then we want them to be able to actually do stuff. So it's one thing to have people who are really gung ho about being on the committee, but
Historic
without
things
tasks
in
to
our county.
do, it's tricky as well. So, it's not for that. We definitely had some applicants, and I'm happy to speak to whoever that is, but it's kind of twofold in that sense.
And these, if there hasn't been a review or a nomination in years, I think that's telling.
when did the canals, when did they go through?
I don't have the memo in front of me, but one was like 2013, 2014,
Doesn't
and
have the years on it.
and then the second canal that's COID oversaw, I want to say it was like 2017, 2018 approximately. When the hearing is conducted, we can go back and give you a summary of what Deschutes County has done utilizing CLG funds, and you'll see that we were incredibly resourceful and exhaustive at looking at opportunities, which it's been a declining slope in our efforts to maximize awareness and attention. And as the closer we've found ourselves to 2023, we've been relying on more sisters projects to see if there would be interest in, like, first with a reconnaissance level survey, maybe an intensive level survey. They did a story map, which Tanya has summarized. Again, as a municipality, they have a Western motif, they have a few historic structures, but even that is, as we thought, wow, looks like there's a lot of synergy in Sisters. Sisters is also juggling numerous responsibilities, which includes historic preservation. But as noted in the amount of resources we were identifying for application for this grant cycle, just wasn't anything that materialized really from Sisters. So we can give you that overview. I think it'll be helpful. But to Commissioner Chang's point, we haven't reviewed an alteration in 10 years. We haven't, outside of the national nominations, we haven't had one for reasons that Tanya noted, that you need property owner consent. You can't, there was a time when government could compel property owners. And I think that happened when we first adopted our historic preservation list. I'm assuming most were willing, but there may have been a handful that it just didn't rise to the level of complexity or controversy. You can't do that any longer. So we'll provide that overview for you and for the general public. And as the chair noted to the individual that was expressing interest in the topic, we welcome input at the public hearing. And maybe we've missed something, but as it stands today, we find ourselves making this respectful request.
No, we'll hear from people if there are concerns about this during the public hearing. One other thought is that, if a big piece of the responsibility of this commission in the past was to add sites to this list and then review alterations to those sites, it's possible that it's possible, and this would be a good thing, that all of the really important historical structures in the county are already on the list. That we've got a comprehensive inventory already. So, if we're not seeing reviews for alterations, then that would also be a good thing. So the lack of activity in the last few years isn't necessarily an indication that we're neglecting our historical resources. It may be an indication that we got a good list and that people are taking care of existing sites on the list.
Yeah, and just one final follow-up is, the way we're trying to structure the code, as Tanya articulated and is noted in the memorandum, we may find that in, I mean, who's to say, 1973, looking forward, that's a 50-year, you have a 50-year structure, whether or not 1973 architecture or cultural, social experiences elevate a certain property, to be noteworthy, but 73, 83, we don't know what the future holds, and we don't know how the community may mobilize in ways that we just can't see right now. But the code is struck, the way we're conceptualizing it is, if and when there is a recognition in the community that historic preservation has reached this new milestone, through our work plan, which is revisited annually, the public can get engaged and make that respectful request to re-engage the Landmarks Commission. And if the board, not the future board, was compelled to that testimony, it could be added and we could relatively seamlessly apply for CLG funds. So it's an emphasis that we're not closing the door for the future. We don't know what will historic preservation look like in 10, 20, 30 years. It may be far different than what it looks like today, and we need to stay open to that. And I think the code concept reflects that possibility.
I'm seeing avocado appliances and yellow shag carpeting, right, from 1973.
It's actually back according to the wall.
Well, there we go. Maybe those are the historical.
The design issue had gold, harvest gold on the
Yep,
cover.
Harvest gold. There we go.
And then we have avocado green showers. So yeah, it was in the Wall Street this last weekend.
Well, this could kick
It
off a
came
great
back
conversation.
50 years ago.
Yeah.
Having
Thank
grown up in the 1970s,
Yep.
I'm not picturing a tremendous amount of stuff of historical significance.
We'll see. But yeah, so I support this also. Let's proceed and welcome the community's engagement in this. For this process, it may be triggering some great community conversations.
Thank you for the
Thank you.
conversation.
Oh, and Tanya,
Yeah.
I had 3 fawn cross 126 this morning on a curve in front of me with a couple with 2 moms. So I thought of you. No, I mean, I was like, it was so happy to see them that you saw the one deer, and then I thought, okay, we better stop. And all the babies went across.
We have a couple in our yard that we've been monitoring, and they're starting to lose their spots.
Oh yeah,
A little bittersweet.
I know. So
Losing their spots.
Thank you very much.
Okay, item number 11, county policy update for family and medical leave to incorporate the paid leave Oregon program.
Morning, Commissioners.
Welcome.
So for the record, Kathleen Hinman, Human Resources Director, and I have with me.
I'm Sue Henderson, and the Benefits and Leave Coordinator.
So we'll make sure that we direct all of your difficult questions to Sue, please.
Mhm.
But Sue is my encyclopedia of leave administration and leave laws. So staff is here to present and seek a motion to approve a revised county policy HR 12, family and medical leave, and it's revised to incorporate paid leave Oregon program and the applicable Senate bills. So in your packet is a final version and a red line version. I'll just do kind of a quick overview of some of the decisions that the county has made along the way. So Paid Leave Oregon is a required program for employers and employees that makes available paid time off for qualified family, medical, and safe leave to Oregon employees. So House Bill 2005 was originally signed in August of 2019, making Oregon the 8th state at that time to establish a paid leave program for employees. Legislation in 2021 delayed the implementation of that, likely due to the impacts of COVID and the pandemic, until 2023. So employer and employee contributions began in January of 2023, and employees are eligible to begin taking leave in September of 2023. So in preparation in fall of 2022, the county made a few decisions we brought to the board. Board gave direction to decisions on implementation of the program, specifically decisions to enroll in the state Paid Leave Oregon plan, to allow employees to use their accrued leave to supplement their Paid Leave Oregon benefits, and to implement the premium cost sharing as it was established in legislation, which is a reminder that's 1% of employee wages, with the premium split employers paying 40% of the 1% and employees paying 60% of the 1%. So in June of 2023, quite recently, Oregon legislature passed Senate bills, actually 912, which I didn't include in the memo, 913 and 999, which impact our policies and procedures relating to administering paid leave Oregon and the Oregon Family Leave Act. So in response, staff has updated County Policy HR 12 to incorporate these bills, which were intended to harmonize these leave programs. In coordination with administration, finance, and legal, staff has made efforts to prepare the county for this program. However, we do want to fully acknowledge that this program is new and continues to be defined. Leave administration is a very complex area of employment law, and these programs and leave entitlements, and as the program and leave entitlements are tested through actual practice, we anticipate additional guidance to be developed, resulting in future revisions to county policy and procedures. So to quote our training by Boley, the airplanes are still being built. So just a summary as follows: as to changes, the proposed changes in HR 12, general administrative and formatting cleanup, adding the provisions that are outlined in Paid Leave Oregon, which are summarized in your staff report. Specifically, Senate Bill 999 added two pieces that we did incorporate into the policy, which is to update the family definition under OFLA to align with the definition under Paid Leave Oregon. And then the other one is the duration of leave and the leave tracking year. So it's an administrative function that actually Sue primarily completes for us in tracking an employee's leave entitlements under both of those programs. So the Senate Bill 999 drafted language to sort of harmonize those two. That concludes the presentation, and we are available to take any questions from the board related to the policy or the changes. And then we do have a recommended motion, which we're seeking decision today.
So the state legislature basically kind of put the words together for us. I mean, I'm just, as I read this, I know it looks like it's just very much the definitions as defined and implemented in our, and this is the current policy. This is just the amendment or the changing of HR 12. Any other?
I guess I would also just say I support this change. You know, it is a great thing to be able to give our employees the opportunity to take care of their family when they need to.
And one thing I noted that it gives up to 2 weeks of bereavement leave to the death of a family member, and I think that's really appropriate.
Yep, that is a leave entitlement under OFLA.
Right.
So we do have that highlighted and sort of spelled out specifically in the policy now. Mhm.
So even if it wasn't in the policy, though, it'd still be a qualification of an employee.
Correct. Mhm.
Good. So this is the policy update, HR 12.
There's no further discussion. I'll move approval of county administrator signature of revised human resources policy HR-12, family and medical leave.
I'll second it.
Any other discussion? No. Seeing none, Commissioner Chang.
Yes.
Commissioner Adair.
Yes.
And chair votes yes. Thank you very much.
Thank you.
We didn't get any tough questions.
Yeah.
for
Oh,
you.
Sue.
She'll get them. very
Yeah, they're coming. They're coming. Yeah,
They're coming.
slicing and dicing the words in there. Okay, is there any other items today? Is there an executive session? I don't think so.
No executive session.
Yeah. Seeing none, meeting adjourned. Thank you.